Hi everyone. Okay, so I actually did this C-section crafty thing that I have been seeing circulating on Facebook. I do have to give credit to, what are they called? Natural Abundance, I think. I'll put their link up underneath this, but that's who I can trace back to who should be credited for this. But it's a nice little model to show women what happens with a C-section, because I get a lot of women that will come back with C-section pain and they don't necessarily understand the procedure that happened. So there's a couple layers to go through. So this is the skin layer, right? And if we go beneath that, then we have fatty tissues. And then after that, we have fascia, which is kind of this nice, strong layer of connective tissue that separates muscles. And then when we come to the abdominal muscles, a lot of people say that the abdominal muscles get cut through, and that kind of, it's a bit of a pet peeve of mine, because it's not the muscle bellies themselves that get cut. It's that linea alba, that white line that you see in the middle of your six-pack. That is what will get opened below the belly button. And then the next layer is your peritoneum. So this is kind of a covering for the internal organs. There's a fatty layer in and around here as well. And then they have to pull down the bladder in a lot of these procedures to move it out of the way. And then they'll make this cut into the uterus. And then you'll see the amniotic sac underneath that. So then you have your amniotic sac. And then you've got little baby that's underneath. So what's neat though is that you can put all of these layers back together here and you can kind of go through. Now, a pregnant belly is 3D. So I did this incision to scale, and I have to say that I have a much greater appreciation for my gynecologist friends, because this is a difficult procedure to do on felt, so I can't imagine doing it on a human. So you do your cut, right? And then you do your fatty layer cut. And then you would do your fascia cut, and then more often than not they do a blunt dissection, so they'll kind of just use their finger. The tissues will be thin, so they can use their finger to open vertically here as opposed to horizontally, and then the same thing through the peritoneum. And then they use a retractor to pull the bladder down out of the way. They would make their incision horizontally into the uterus. They would rupture the amniotic sac, and then you've got little bambino in there. So they'd suction away that fluid, and that whole process takes about 5 minutes or so. And then to stitch everything back up, they have to go through those layers. And I don't want people to think they put stitches into all those layers, because they don't. And actually you see quite a big variation from surgeon to surgeon and from hospital to hospital as to which layers will be sutured up. But there's lots of different options for how they close back up. But it just gives you a little bit of a idea, I guess, of all of the tissues that they have to go through, and why you can be a little bit sore from hip bone to hip bone after having a delivery. And I think it also encourages that women should take the proper resting time, if they can, to the best of their ability after baby comes out, because we need all of these layers to heal as best as possible. So that's kind of my patient version talk that I give. If you are a practitioner and you want to know the more medical healthcare version of that talk, then send me a message and we can talk about that a bit more. Okay? Thanks for watching. Bye-bye.